Algor means coolness and Mortis means death. So it is basically the cooling of dead body. The graph is like this. Skin and subcutaneous tissue are insulators of heat, so initially the temperature does not fall. At intermediate phase, it falls rapidly. At terminal phase, it falls slowly. Ultimately, it equates to environmental temperature. The shape of the curve is bi-exponential or sigmoid or inverted S-shaped. Cooling occurs because energy production stops and heat regulatory center become inactive. Temperature of the surface falls more rapidly than the core temperature. We measure the core temperature in the following sites. For this, clinical thermometer is not used. Chemical thermometer is used. Nowadays, digital probe thermometer is used. Environmental temperature is the main factor. Rate of fall of body temperature is directly proportional to the difference between environmental temperature and body temperature. Air movement causes quick fall of temperature. It is rapid in humid condition. Media of disposal: earlier in water and late in buried body. Built of cadaver. Obese bodies cool slowly because fat acts like an insulator. Rate of loss is more in children and elderly because they have more surface to volume ratio. Females lose heat slowly because they have subcutaneous fatty tissue. Clothes and coverings decreases heat loss. In curl position, heat loss is less. Mode of death: in sudden death, it tends to cool slowly. In chronic illness, it cools rapidly. Medico-legal importance: it is the first sign of death beyond the obvious. Time since death can be calculated as normal temperature minus measured temperature by rate of fall. Average rate of fall is 0.4 to 0.7 degrees Celsius per hour. Rectal temperature is high in case of struggle or exercise before death. Rapid cooling delays rigor mortis and decomposition. Post-mortem caloricity is a condition where, instead of initial cooling, the temperature remains high for about 2 hours. This is due to post-mortem glycogenolysis or infection, septicemia, bacteremia, convulsion, heat stroke, pontine hemorrhage before death. So this is the summary.